Thank you, Chris. Welcome. My name is Brianna Weston. I am one of the trainers here at the Oregon Immunization Program. I'm a white woman. My hair is pulled back. I'm wearing a light blue shirt and blue glasses. I gotta get my things working. Hold on. I'm going to be joined about halfway through by Corey, who is a data exchange assistant analyst over on the data exchange team. She's going to be doing the EHR connection to Alert IIS, which is super exciting. So for the next half hour, we have three big goals. The first one is to talk about immunization information systems. What are they? How does Alert IIS pertain to that? Our next one is updates. So we have the replacement project, and then I'll do a general OIP training portal update as well. And then Corey is going to be doing the data exchange part. What is data exchange? Main methods on how it works, and then how to be successful using data exchange. Before we dive into that, we are going to find chat and reactions. Ask a lot of questions. There's a lot of interaction in this short little presentation. So if you found the chat, go ahead and say hello, or if you found your reactions, give me a thumbs up or whatever our other options here. I'll find them too. You can cry or laugh if you like. There's hearts. Beautiful. I'm seeing all kinds of things going on. All right, we have people. Cool. So the reason I asked you is because we start off with a thought experiment. And that thought experiment is, how well would you track your own vaccination history on a scale of 1 being the worst and 10 being the best? You have to keep track of the vaccine you were given, the date you were given it, where you were given it. And to kind of put this in perspective, you can go ahead and start throwing your numbers in the chat if you have an idea, but if you need some more context, according to the CDC vaccine schedules, in 65 years of life, we get 43 shots of 14 different vaccine types, and that does not include our seasonal. So we're talking 65 flu, we now have RSV and COVID as well. And on top of that, the average person moves 11.7 times in their lifetime, which, you know, adds to that wear aspect. I'm seeing 1, 7, 2, 3, 4, 5, 2. Amanda's on, she'd give us a 10. Ryan would give us an 8. Some of us are much better than others. Right? Mine's a 5. Like, I'd probably get half the information. Maybe. Why are we tracking this? Why is it important to know this information? You can write it in the chat. To know what we are and are not protected from, to avoid duplicate vaccinations and data, monitor community immunity. I love that phrase, community immunity. To know if we're at risk, to get a better idea of needs in case of an outbreak. Yeah, herd immunity. So we don't have pages and pages of dashboards for no reason. We have them for a very good reason, right? Like, we want to track outbreaks. We want to make sure that our community is healthy. So what I'm getting at here is that left to an individual's own devices, knowing how well we're vaccinated is probably not the best idea. And we need to know this information. It's important to our community health to know that we are vaccinated, who and who is not vaccinated. So individuals being responsible for this is not a good idea. The solution that we have come up with is Immunization Information Systems, IISs. So we're going to explore that a bit more. How many, or not how many, can you name different places that you can get vaccines? The obvious one being your doctor's office. Where else could you get a vaccination? I have 8. There's more than 8. Pharmacy's health department. Yep. Dentist. Very good. Vaccine events, mass vax events, OBGYN, school-based health centers. A lot. There's a lot of different places, right? Um, Workplace, like flu clinics, right? You can get to do that. What else is on here that's not on there? Urgent care, hospitals. Um, yeah. Oh, Department of Corrections is one I keep meaning to add to this list, and we have not. I have not done that yet. So all of these places give vaccinations, and they all need to know who gave what when, so they don't do things like give people two vaccinations for the same disease. Tribal clinics, very good. That's another one I should add. Lost my thought. So all these places need to know who gave what when. And so immunization information systems are the databases that house all this. So all of these places input, I gave patient A vaccine B, so that somebody else can say, oh, they've gotten that vaccine B. I have a graphic that goes with it. Watch. It's like magic. So immunization information systems are this solution. There's actually 62 immunization information systems in our country. There is, we call them jurisdictions, 62 jurisdictions that the CDC oversees. There's 50 states, one for each state. So that's you read the immunization information systems definition, it talks about geopolitical lines and they mean states. And then we have 4 cities with their own: New York City, Philadelphia, District of Columbia, and San Antonio. I have not researched how those came to be, but I'm sure it would be interesting. And then we have 8 islands that have them as well. If these existed in this configuration when you were a kid, how many would have data about you? So basically the question is asking is how many of these 62 places have you lived? 1. Mine's 7. It might be 8. I don't remember. I got vaccinated. 4. So Chris says of these 1, which brings up a big point. I'm saying that there's 62 IISs in the United States, but that means that there's also IISs around the world, right? Other countries have databases that keep track of this information. I don't know what they're called, but they do. Okay. I think 4 is our highest. You win, Irma. Here in Oregon, we call ours Alert IIS. There's some fun names across the country. Louisiana is Lynx. Jenny McKibben is not here. She's the director of Alert. Her favorite is Georgia, which is Grits. Idaho is Iris. Philovax for Philadelphia. So there's some fun names. We call ours Alert IIS. IIS stands for Immunization Information Systems. Alert doesn't stand for anything. It's a big question we get. All right, who is using Alert? I like to differentiate our audience of Alert into 3 kind of buckets. The first bucket is going to be parents and the general public. For a person in the state of Oregon to get their immunization record, they send a request, a form to our help desk, and the help desk fulfills that request, and then either emails or mails or faxes that individual's immunization record back to them. So that is one of the big things that Alert IIS can do, is it creates that record that we can then, and you guys can do this too, you guys can generate immunization records for people as well and give them to them. And we need those for what? We need them for travel sometimes. We need them for working sometimes. Schools and childcare, as we heard from Monse earlier, they need that data as well. So sometimes it's requested from parents, hey, can I get your kid's immunization record? So proof. Other big audience is healthcare providers in schools and childcare. So these are the industries in Oregon that are using this information. Healthcare providers are entering the information. You guys put the information in there, right? You're saying patient A got vaccine B on this date. There's also a forecasting function in Alert IIS that tells you guys what people are due for. So green means go. You've probably heard that phrase in our standard user training saying, hey, if it's green, offer that vaccine. Schools and childcares, like I said, Monty talked all about this. They have, schools and childcares have a kind of like a query only access to Alert, so they can pull those records themselves. There's limitations to that. That's why we ask parents sometimes. But yeah, they have access to that data as well. And then the last group is public health. So here at the Oregon Immunization Program, one of our biggest tasks is to keep Alert IIS up and running. We manage the system, we make sure it works, make sure that you guys can connect your EHRs to it. So there's a lot of management of the system. There's also epidemiologists use it for outbreaks. So with, for example, we have the measles outbreak in Clackamas, Marion? I don't know. I'm obviously not an epidemiologist, but we have the measles outbreak. So we have the epidemiologists and the data people going in and pulling data out, figuring out who has been vaccinated in that community, because they can determine how far and how fast that disease is going to spread. And depending upon that information is going to influence their plan of action. How much do we have to limit? Who do we have to prevent from going places, limiting access so we can kind of slow and not spread that disease. So plan of actions, outbreak plan of actions are using the data out of here. And the last one is equity. So OHA has an equity goal of 2030, where we're trying to make sure everybody has access to healthcare, including vaccines. And so we have we do some things like equitably distribute vaccine, and we saw this with COVID. So when COVID vaccine first came out, certain people got it first because they were the most at risk for it: healthcare workers, schools and childcares, the elderly, babies, or not babies because that was later. But they distribute it in such a way that they were creating the most impact. And so that will also happen. And we use that. That happens through the inventory management access of Alert IIS. Knowing where vaccine is helps us make sure that the communities who need it most have it. All right, questions? When did immunization information systems begin? It's a great question. I don't know. Alert IIS in 2009 had a big change here in Oregon. I know that much. The program or the database capturing, Mimi?
Sorry, I didn't write that right. Yeah, we were like 98, 99. We got turned down for funding from Robert Wood Johnson, and so began in earnest getting funds to build our own alert system. Of Sherry's question.
Sherry, is there a record of somewhere of all my vaccines? No. And that's why I said that's why that qualifier was in there. If these existed like they exist today, how many would have information about you? You probably have a paper record somewhere. Are there any pharmacy chains that don't participate in Alert IIS? It's a good question. That is one I'm going to have to pass on to somebody else and see if we can get an answer. I know the big four do. If I don't write it down, I won't remember. Regina asks, when will all these alert systems talk to each other? So alert is what we call ours, and all the other states calls theirs something else. I don't know when they will talk to each other. We are connected to Nevada. We would like to be connected to Washington and Idaho and New Mexico. We can't connect to California because they have a law that says they can't share their citizens' information. So that's a non-starter until they figure that out. And then Mimi's clarifying things. Alert began in 1996 as a childhood immunization information system, but in 2008, it grew to include all ages. In 2010, Alert became Alert IIS, an even stronger web-based system with many new features. Yeah. Good questions. I'll get back to you on that pharmacy one, see if I can get an answer. I think Nick's trying to help us answer it. Any pharmacist who immunizes must report all immunizations administered to the IIS in accordance with this law. All pharmacists, but only participating providers. Does that mean state-supplied vaccine, Nick? They're getting state-supplied vaccine, they have to report?
No, this is a rule that comes before talk about state supplied vaccine. There are definitely additional requirements for sites that are participating in a state supplied vaccine program that don't apply to all alert users, but this is talking about how the IIS applies to vaccinators without respect to those programs. And so it appears to be saying that a medical provider, can choose to vaccinate but not participate in the IIS, but a pharmacist must report. And so my impression is that the answer to that question is that pharmacists who vaccinate have to report to alert.
So all pharmacists who vaccinate report. Thank you. We got it. We got our answer. All right, I have two updates and then we'll pass it on to Corey. The first one is about the replacement project. This is a multi-year project that is happening. So we have a rule in Oregon that all big systems have to go through a complete revamp every 10 years or so. And we are doing that for Alert IIS. So we are kind of middle of that project. There's an end goal of 2027 to have it be up and running by then. We are submitting RFPs right now, requests for proposal. Basically, we are looking for companies that can do this, can make an IIS for us. There is listening sessions. That second day of those regional meetings is our listening sessions. I think Chris pointed them out at the very beginning. Klamath Falls and Coos Bay had openings still, and then you can get on wait list for the others. So if you have thoughts and feelings and about our IIS and what you want it to do, come to one of those listening sessions and let us know. You're the ones using it, so we want to know what you want it to do so we can be more efficient and effective for you guys. And then as a part of the training team, I'm going to do a quick training update. We are in kind of a building phase right now. Our new standard user course is getting really close to being published. We expect it to be in the next month or two. You will hear about that through that Oregon Immunization Partner Updates listserv. So any changes we do make, we will announce it through there. We're also working on the VFC overview that gets changed on a yearly basis. So we're getting ready for that January launch. And we are in the beginning phases of building an inventory module, which we're super excited about. That's not going to be for a while, but it is starting. So you can look forward to that. We have a lot of other changes coming. We'll let you know about them when they happen through the listserv. All right, we're going to turn it over to Corey. You here? You're here. Can't hear you.
Sorry, my mic was not positioned properly.
All right, take it away, Corey. Let me know
Okay,
when you want me to
thanks.
switch page.
Great. All right, so what is data exchange? It's also known as interoperability, or as we like to call it, DX. It's simply two or more computer systems talking to one another and exchanging data back and forth. Next slide, please. So the main methods of data exchange are bidirectional DX, which is when an organization submits vaccine records and queries or looks up vaccine histories or forecast information. And bidirectional DX is considered the gold standard. It's our most common connection, and data can be exchanged in real time, meaning it takes just seconds. And about 90% of our IIS data is through bidirectional data exchange, and 95% is being sent same day. And then there is unidirectional DX, meaning an organization only communicates one way with Alert IIS. That can be either reporting only, where they only submit vaccine information, or it can be query only, where the organization only looks up patients' vaccines history or their forecast information. Next slide, please. And here's just a quick overview of the data flow for when Alert IIS is queried for a vaccine history or forecast. First, the clinic staff requests the patient's history or forecast within their EHR. The request is then sent to Alert IIS. Alert receives that message and then responds to the EHR with the patient's history or forecast. And lastly, the EHR receives that response as the immunization history and or forecast in the patient's record. Next slide. And then on the other hand, when an immunization record is being submitted to Alert IIS, the vaccine is recorded in the EHR after it is given. The EHR sends the message that the vaccine was given to Alert IIS. Alert receives that message and adds the information to the patient's history. Then it returns a message to the EHR, and the EHR then receives an acknowledgement message from Alert and stores it to the patient's record in the EHR. Next slide. To get started with data exchange, your organization must first be enrolled with Alert IIS, and once approved, an AL number will be assigned. After your organization has an AL number assigned, onboarding can be requested via our data exchange registration form. That form and more information about data exchange, the onboarding process, and helpful documents can also be found on our webpage. Next slide. And being prepared before getting started with data exchange will lead to more success with the DX connection and with maintenance throughout. It's important to know how to contact the DX team for questions and technical assistance, and to know how to contact your EHR system support team. They must be involved in the onboarding process, troubleshooting issues that may come up, and communicating changes or updates with you. Next slide. And it's also important to know who on your staff is responsible for monitoring data quality and can begin troubleshooting if or when issues occur. This person or team should be aware of the following factors, as any of them can impact data exchange, and those are changes in vendors, like a new EHR or sending vendor, recent system updates with Alert IIS, your EHR or your sending vendor, the connection between your EHR and sending vendor, and any upcoming system maintenance. And also important news, now standard and super users can access the Alert IIS data exchange report. And with that, there is also the Alert IIS data monitoring course on the OIP training portal, which provides guidance on using both the data exchange report and the ad hoc list report in coordination to troubleshoot whether a data exchange error could be the cause of inventory discrepancies. Any questions?
Not seeing any.
Okay, well, thank you. Back to you, Brianna.
Thank you, Corey. All right, so we're going to finish this off by building a data map. So we started with alert, well, we started with all the IISs, but we're going to focus on organs, which is Alert IIS. And Corey connected your EHR to Alert IIS through that data exchange connection. But here's the deal. Yours is not the only clinic we connect to. We connect to a whole bunch of organ clinics, right? So there's all this transferring of information. It takes us back to that slide when I asked who is giving vaccines, and they all report to one spot. Most of you are reporting to your EHR that tells Alert. And then some of you have an additional level of complexity. You have a vendor involved that kind of acts as a middleman to get that information into Alert. And the only reason I pointed out is because with that extra step adds a possible extra spot where things can break. I fix a lot of things, can you tell? All right, but we're not just connected to EHRs, we're also connected to other state databases. A really good example of this is vital statistics. So when a new baby is born in the state of Oregon, there's a new record in vital statistics for them. When that record is created in vital stats, it then gets sent to Alert IIS. So when that baby goes in to get its routine immunizations, that new provider doesn't have to create a brand new record. They're just going to add to the record that's already there. We're not just connected to one other state database, we're connected to a bunch of other state databases. So this includes, WIC and Medicare and OR Kids and all kinds of other stuff. So there's a lot of connections there. Somebody asked about other states. We are connected to Nevada. That one is done. We want to do Washington, Idaho, and New Mexico. Those are on our wish list. There's other organizations and processes involved, so we just have to wait to be able to start those projects until we get a go-ahead. We're also connected to some federal agencies. So CDC is our grant funding organization. They're going to want some information. They also see, disease spread. So they're going to want some stuff. So they have access to non-identifiable data, but we're also connected to the Veteran Health Administration locations in Oregon and some in Washington as well. So you'll see individuals who visit those locations, their vaccination information in Alert IIS as well. When we are looking at this, what is the first word that comes to your mind? Go ahead and pop it in the chat. Complex. HIPAA. It's a miracle any of this can work, right? It's a lot of work. Yeah, I agree. That's why my word is impressive. All of those arrows represent work, people building those connections and maintaining those connections, making sure that they continue to work. It is very impressive and complicated that it exists like it exists today. And with that, I am done. Do we have any final questions?